Bruce Willis, the iconic Hollywood actor known for his roles in blockbuster films like Die Hard, The Sixth Sense and Pulp Fiction, has been facing significant health challenges that have altered the course of his life and career. His wife, Heming Willis, recently provided a deeply emotional and candid update about the actor's ongoing battle with frontotemporal dementia, FTD, a rare and progressive neurodegenerative disease. This update, shared in a heartfelt interview, sheds light on the profound impact of Willis's condition on his family, his personality, and his ability to engage with the world around him. The news has sparked concern among fans who have followed Willis's illustrious career for decades, as well as admiration for Emma's resilience and advocacy for caregivers navigating similar challenges. Willis's health journey began to surface publicly in 2022 when his family announced that he was stepping away from acting due to a diagnosis of aphasia, a condition that impairs a person's ability to communicate effectively through speech or writing. At the time, the announcement was a shock to fans who associated Willis with his sharp-witted, charismatic performances. Aphasia, often caused by brain damage, was initially thought to be the primary issue, but in 2023, the family revealed a more specific and devastating diagnosis: frontotemporal dementia. FTD is a rare form of dementia that primarily affects the frontal and temporal lobes of the brain, regions responsible for personality, behavior, and language. Unlike Alzheimer's disease, which is more commonly associated with memory loss, FTD often manifests in changes to a person's social conduct, emotional expression, and communication abilities, making it particularly challenging for both the individual and their loved ones. Heming Willis, who has been married to Bruce since 2009, described the onset of his symptoms as subtle but alarming. She noted that Willis, once known for his warmth, humor, and vibrant personality, began to exhibit behaviors that were out of character. He was just a little more quiet in social situations, she explained, recalling how he would melt away during family gatherings, a stark contrast to his typically talkative and engaged demeanor. This shift was initially difficult to pinpoint, as Willis had a history of a childhood stutter, which Emma initially attributed to the changes in his speech patterns. It felt a little removed, very cold, not like Bruce, who was very warm and affectionate, she shared. The transition to a more withdrawn and less communicative state was, in her words, alarming and scary, marking the beginning of a journey that would reshape their family's life. The diagnosis of FTD came after a period of uncertainty, as the disease is notoriously difficult to diagnose due to its gradual onset and varied symptoms. Emma described the moment of receiving the diagnosis as akin to free falling, a moment of profound shock and disorientation. She recounted leaving the doctor's office with little more than a pamphlet on FTD and a sense of hopelessness, as there are currently no treatments available to halt or reverse the disease's progression. This lack of medical intervention adds to the emotional weight of caring for someone with FTD, as families are left to manage the disease's impact with limited resources and support. Emma's candid reflection on this experience underscores the challenges faced by caregivers, who often feel isolated and overwhelmed in the face of such a diagnosis. Despite the progressive nature of FTD, Emma emphasized that Willis remains physically mobile and in relatively good health overall. "Bruce is in really great health overall, she said, highlighting the contrast between his physical vitality and the cognitive decline that is increasingly evident. The primary symptom for Willis has been the loss of language, a particularly poignant loss for an actor celebrated for his quick-witted dialogue and memorable one-liners. The language is going and we've learned to adapt," Emma noted, describing how the family has developed new ways to communicate with him. These adaptations are a testament to their resilience and commitment to maintaining a connection with Willis, even as the disease alters his ability to express himself. Emma's update also highlighted the fleeting moments of joy that still punctuate their lives. She spoke of catching glimpses of Willis's familiar personality, his hearty laugh, the twinkle in his eye, or a sly smirk, that momentarily transport her back to the man she has always known. "It's just hard to see because as quickly as those moments appear, then it goes," she said, her voice heavy with emotion. These brief flashes of Willis's former self are bittersweet, serving as both a reminder of who he was and a painful acknowledgement of the disease's relentless progression. Yet, Emma expressed profound gratitude for these moments, emphasizing that she is thankful that her husband is still very much here, even if in a different capacity. The Willis family, which includes Emma, their two daughters Mabel, 13, and Evelyn, 11, as well as Willis's three daughters from his previous marriage to Demi Moore, Rumor, 36, Scout, 33, and Tallulah, 30, has rallied around him, providing a strong support system. Emma has been particularly vocal about the importance of community and connection in navigating the challenges of caregiving. In the early months following Willis's diagnosis, she admitted to trying to manage everything alone, which led to sleepless nights spent ensuring his safety and a tendency to isolate the family from social gatherings to make life more comfortable for him. This experience, she said, was unsustainable and prompted her to advocate for greater support for caregivers. To this end, Emma has channeled her experiences into a new book, The Unexpected Journey: Finding Strength, Hope, and Yourself on the Caregiving Path, set to be released on September 9, 2025. The book aims to serve as a roadmap for others caring for loved ones with degenerative illnesses, offering insights into self-care and resilience. Caregiving takes a village. You cannot do this on your own, Emma emphasized, reflecting on the collective effort required to support someone with FTD. Her advocacy extends beyond her writing, as she recently participated in a landmark event at the California State Capitol, where lawmakers passed a resolution establishing September 21 to 27 as Frontotemporal Degeneration Awareness Week. This initiative, supported by the Association for Frontotemporal Degeneration (AFTD), underscores her commitment to raising awareness about the disease and its impact on families. Emma's advocacy is also a response to the misinformation and speculation that often surround Willis's condition. In July 2025, she took to social media to address misleading reports about his health, urging people to disregard sensationalized headlines and anonymous sources. If you ever come across a story that begins with "sources close to the family say," do yourself a favor and stop reading, she wrote, emphasizing the harm caused by such speculation. This plea reflects her desire to protect Willis's privacy and dignity while ensuring that accurate information about FTD reaches the public.